Hello, this PowerPoint presentation will examine the use of lithium in its treatment for bipolar disorder. Lithium has been used for over a half a century for the treatment of bipolar disorder as a typical mood stabilizer. Lithium is particularly effective in controlling acute mania and maintaining long-term mood stability. Its unique anti-suicidal property sets it aside from other mood stabilizers, although its effectiveness in treating depressive episodes has been described as moderate. Some studies suggest that lithium may help reduce cognitive decline in patients, but further research using neuropsychological and functional neuroimaging techniques is needed to confirm these findings. Lithium is known for its ability to preserve or increase the volume of brain structures associated with mood regulation, such as the prefrontal cortex, hippocampus, amygdala, which may reflect its neuroprotective properties. At the neuronal level, lithium decreases the activities of excitatory neurotransmitters such as dopamine and glutamate, while the inhibitory neuron transmission, primarily the GABA. This balance is essential for emotional stability. Agent used in the treatment of bipolar disorder. It aims at the prevention of relapse and is used in the treatment of acute episodes such as mania depression and specific subtypes such as blood episodes and mixed features or rapid cycling. Lithium remains the gold standard in achieving effectiveness in both type 1 and type 2 bipolar disorder. Lithium has been shown significantly to reduce the risk of new episodes in mania and depression. A study by Jones and his colleagues in a 2020 study evaluated the effectiveness of lithium on anxiety symptoms in bipolar patients. The study showed significant improvement in anxiety observed by the measurement of the HAM-A scale. Lithium usage is associated with notable reduction in anxiety symptoms in bipolar patients, especially those with recurrent depressive episodes. A positive correlation was identified between changes in the HAM-A scores and improvement in overall mood. These results indicated lithium's potential role in addressing often overlooked anxiety symptoms in patients with bipolar disorder. The findings highlighted the need for therapeutic options for comorbid anxiety and bipolar disorder, given the significant psychosocial burden. An updated systematic review and meta-analysis. It was shown that lithium is an effective treatment for reducing the risk of suicide in people with mood disorders. Lithium may exert its anti-suicidal effects by reducing relapse of mood disorders. Still, additional mechanisms should be considered because there is some evidence that lithium decreases aggression and possible impulsivity, which may be another mechanism mediating the anti-suicidal effects. Bipolar depression plays a major role in bipolar disorder type 1 and bipolar disorder type 2. It is responsible for a large number of suicides. The suicide rates are 20 times above that of the general population. In a large study, it found that lithium was not more effective than placebo in treating bipolar depression. Bipolar type 2, lithium was significantly less effective than the antidepressant. These guidelines argue that lithium should be considered an acute treatment of bipolar depression due to its central role as mood stabilizers, its effectiveness in preventing mania, and the proposed anti-suicidal effect. Rapid cycling is defined as a course of bipolar disorder that includes at least 4 distinct mood episodes, including major depressive, manic, hypomanic, with or without mixed features, occurring within a 12-month period. Patients with rapid cycling suffer from a higher burden of symptoms, higher rates of suicide attempts, and completed suicides, and they are frequently suffering from other psychiatric comorbidities over their lifespans of bipolar disorder. All available treatments show lower effectiveness in patients with rapid cycling, and lithium may show better efficacy than other mood stabilizers except for valproate. Item 5 substitute these terms by the so-called mixed specifiers, which indicate the presence of mixed symptoms in either hypomanic or depressive episodes. In patients with manic episodes and additional depressive symptoms, lithium was found to be less effectively than valproate. Studies investigating the effectiveness of lithium in the maintenance therapy found it to be less effective in patients with mixed symptoms than in patients with pure mania. Lithium has been approved for acute and maintenance therapy for mixed and manic episodes and bipolar 1 for children and adolescents ages 7 to 17 years old. Like adults, thyroid hormone status has to be clearly monitored. Lithium and pediatric bipolar disorder, which have been reported and therefore must be recognized, are suicidal ideation, changes in blood cell counts, and neurological side effects. Lithium in pregnant and postpartum women with bipolar disorder. Recent research suggests that lithium discontinuation may be responsible for the elevated relapse risk during pregnancy, as pregnancy itself only has a small relapse rate in bipolar disorder. Women with bipolar disorder are at an elevated risk of reoccurrence during pregnancy, partum or postpartum period, with a relapse rate as high as 40 to 70%. Patients aged 60 years or older account for a quarter of all bipolar disorder patients. Bipolar disorder patients in older ages have significantly reduced life expectancy up to 15 to 20 years. Lithium is considered the first line of medication in older adult patients with bipolar disorder in maintenance therapy. It is recommended for the prevention of depression and mania, given the evidence from adult studies. Lithium is prescribed less frequently in older adults, although it is usually well tolerated by most of these patients. Side effects of lithium over the lifespan. Cardiological harm may also arise from lithium treatment. Lithium treatment patients have a reduced concentration ability of the kidney and is associated with long treatment durations and is found in 54% to 73% of patients. It may lead to chronic kidney disease. A clinical relevant impairment of renal function does not usually occur before at least 15 years of lithium treatment. Patients with bipolar disorder have a higher risk of developing dementia compared to the general population, and lithium may be protective in these patients. Weight gain is a well-known side effect of taking lithium. A study suggests that an average increase in body weight of 6 kilograms at the treatment duration of 1 year. It was also reported that weight gain was only observed in patients who were already obese. At the beginning of the study among non-obese people, no such weight gain was observed. Lithium intoxication is also a side effect of taking lithium. It's characterized by confusion, gross tumors, as opposed to a fine tumor. Gastrointestinal symptoms such as vomiting, diarrhea, or retrospective cohort study found it to occur in around 1 in 100 persons a year. Social demographic factors, including socioeconomic status, do not appear to be a major determinant to adherence. However, an online study suggests that younger patients are more likely to be non-adherent to lithium. The role of sex and gender identity in adherence has been explored in a cross-sectional study of bipolar disorder patients. Overall, there appears to be no significant difference in adherence between men and women. Poor adherence has been associated with rapid cycling, previous suicide attempts, early onsets of illness, active anxiety, or alcohol use disorder. A greater number and severity of affective symptoms not being in full remission, having comorbid obesity, compulsive disorder, suffer from arrest, recent manic or hypomanic episodes. That effects can be an important factor contributing to non-adherence. An online survey of 469 patients with self-reported bipolar disorder identified that weight gain within 3 months was a side effect most likely to impact on adherence to bipolar disorder, followed by cognitive side effects. A 2005 study compared Devoporex with lithium and rapid cycling bipolar disorder found that in double-blinded monotherapy phase, tremors and other side effects were significantly more common with lithium compared with Devoporex. These are my references. Thank you. I am Eugenia Powell. Thank you for watching my PowerPoint.